Two ends, always head in, foot in. Okay, it doesn't go both ways. What's for the head is for the head, what's for the foot is for the foot. Now, your indicator for the head side is this yellow pill. Okay? That's where the head should be. What else? Two HEPA filters at this side. Two HEPA filters should be installed at this side. Alright? Third thing, we have one disposable HEPA filter. However, it should be installed from the inside, okay? So, two external HEPA filter. That should last you 3 months since you start using it, okay? And one single-use HEPA filter that should be disposed after using it for every single patient. So 1 year. You got it? Time for the components. You have air blower or air pump, exactly the same one that we use for the PAP. You have two external HEPA filter at the head end, and this should last you 3 months. One internal organic HEPA filter, one single use, and then dispose after that. 4 spine sticks, and then the hose that should connect the air blower or the pump right to the disposable organic HEPA filter. Now, this isopod, why is this? These straps, you strap them around so that the isopod would not fall off the stretcher, okay? Stabilizing your patient along with the isopod itself in case the patient use. In the negative pressure room, don't ever deploy unless you are right in the destination, which is another negative pressure room or isolation room, okay? Assume that you are in the ambulance or walk in the hallway and the patient got claustrophobic, and then we're talking about really positive corona, okay? And this patient gets panicked. You cannot keep the patient inside. You have to deploy, okay? You'll have to deploy. We are here to give comfort to the patient, not to torture them, okay? Imagine you deployed without having your packer or well-fit tested mask N95. You will get exposed and then get infected or infect everyone around you, including yourself. Okay, that's why you should use this. That's the critical point. I'm trying to explain to you that you should use this isopod along with the pack. Okay, when you open this one, you might snap your face up. Watch out! Don't get blashed out any of these sticks, okay? Alright. Preferably, okay, you should use bed sheet. Why is this? Is the surface of the patient is intubated or you're picking them right off stretcher, it would be preferred if you put a bed sheet. Okay? You got it? You have to tuck it really good. Why is that? Because we don't want the end of this sheet to be flapping and blocking any of these air filters. External filters, okay? Pull out these caps. Come over here, please.
These are on the outside.
This is the external outside, exactly. Okay? These are the filters that should last you 3 months is the date of opening. Tuck it in, just hand tight. Okay? Now, next thing you want to do is The internal organic disposable filter, one use filter. At the foot end, hand tight. Okay. Next thing you want to do is the pump. Okay. When we use this pump for the PAPR, it's not the ISOPOD we're talking about now, it's just the PAPR. When we use this one for the PAPR, okay, the button and along where the air blows should be upwards. Okay, that should be exactly right here. However, for the ISOPOD, it should be turned upside down. Okay? Upside down. You got it? So the cap is off. And only one cap, the one right next to the button, should be uncapped here. So you have only two ends that are open. There's a pouch here or a pocket for it. You should put it. There's a pouch where you should put this air pump. Okay, and it's a Velcro lock. And there you go. That should be you now. Okay, that's how it should look. That's how it should look. Then comes the connector. What you notice about this connector, it has two different ends. Okay, it has a straight allure. Okay, and it has an angled wing. Angled wing. Which one goes to which? Now, the straight allure should go where in the PAPR that we should put a filter here. Okay. And exactly, again, just hand tight. Just simple hand tie. Got it? Alright. The angled one should go exactly at the opposite end where the disposable organic filter is. Just right there, and once again, hand tight. Come over here, guys. Down here, one. There you go. Okay. Life Pack 15. Any equipment that you should connect to your patient right before zipping the isopod. Okay. You have how many cords? One at the head end, and another one at the foot end. Common sense, what should you put through the head end is?
Intubation.
Lovely, airway. What else?
Airway.
In case your patient is alert, conscious, and all of a sudden deteriorate, develop some kind of cardiac arrest, you should put here through high flow oxygen connected to BVM, airway adduct. Okay? Probably some suction tube. You never know when you're going to use it. Khalid, one more. As to answer your questions, that's how things get connected through this isopod or through this device. Alright? But saying that, في ناس ممكن تقول في تهريب من هنا مثلا يصير تهريب. Okay? There's nothing, or there is no harm if you wrap gauze, okay, and just tie it through it. Although I don't think that it should be that hard, you know, for you guys. Okay, we should attach this already sealed, guys. Okay.
More patients?
No patient, don't have to insert any patient here. No, you don't have to. Now, attach the ribs. You have 5 pairs of ribs. Okay? 5 pairs of ribs, and you have 4 sticks of spine. There you go. Sticks, please. All one. Ibrahim, Muhammad. Sit one in here. Okay. Right to the center. Okay. Once you are done, notice that the zip goes from the foot end. The zip goes from the foot end. Okay? Why is this? Less anxiety for the patient. No one's really comfortable if you zip starting with the head. Alright. Move this all the way to the end and make sure it really sets at the end. Perfect seal. Now, start your pump. Starting and blowing.
So how do you start it?
It's right here through the bottom. Okay, gentlemen, the pump, one deep press for turning on, and you should hear 4 high tones. You could hear it. Got it? Okay. When you turn it, you should hear 3 low beats. We have moved, loaded the patient right into the ambulance. We reached where our destination is, into right into a negative pressure room. What do? Alert and announce everyone before you deploy. Let's say someone over there coming in without their mask, anything, assume anything at all, okay? Announce your deployment, or announce something prior to deployment, okay? All right? And now, you are right inside the negative pressure room. Deploy. There you go. Remove your sticks. Detach your ribs. Follow them. Cardiac arrest. There are 7 pairs of gloves, left and right. 7 pairs. That is about 14 gloves, okay? Khalid, face me here. You see, you can manipulate your patient through here. Alright? Bagging, making a perfect seal, there's nothing wrong. Okay, let's say that the patient now needs chest compression. He's into a CPR. What do? The first chamber, to the head, insert your right hand to the left glove, and then insert your left hand to the right second chamber. Khalid, do the same, face me here. أيوة عكسك. You don't have to insert your hand fully, okay? Hold on to these. امسك هذا الربط نفسه. Pull it out. Attach, alright. Now, straight out, and then start your chest compression. Okay? This is flapping because there is no load in it. If there was a patient, it should be steady. You got it?